Hi, it's Dr. Buford. We're just getting started on your left shoulder. We're looking in from the back to the front. Everything you see is magnified about 40 times on the screen. The first thing that you can see is this biceps, and you can see how frayed your biceps tendon is. I'm going to put in a shaver just to use more as a pointer. But this is your biceps to the right of the shaver. To the right of that is this really big tear in the rotator cuff tendon. We'll go ahead and turn on the shaver and get that spinning in just a minute. But while we're getting that done, we'll have a look at the rest of this. So the biceps anchor's torn quite a bit. We're going to be doing a biceps tenodesis because of that. The other thing that's remarkable at this point is you have a lot of arthritis in the shoulder. So you've lost some cartilage on the glenoid here. You've got some kind of degenerative labral tearing in the back that we'll take care of. This posterior capsule looks good. But the humeral head, you can see how it's kind of irregular. And there's areas here where you've lost essentially all the cartilage on that ball at the top of the screen. So we'll go ahead and plug in the shaver and get it going. Show you some more in a minute. Okay, so we're looking from the front to the back inside the joint, and you can see there's these areas here where the labrum's torn, and we're just trying to smooth out. Lift up on the shoulder, please. We're trying to smooth out these areas here with our shaver. We're just about done with this part. But you can see, like, here's a little, for lack of a better term, here's a little pothole in the glenoid articular surface here. I'm just making sure there's nothing really loose. But this is why we do a lot of our regenerative medicine injections in the office too, to prevent this from getting worse, and so you don't need to come back to the operating room for a shoulder replacement down the road. But okay, that looks a lot better than when we started. So now we'll get to work on the biceps. Okay, so we're done with the biceps tenotomy, which means we release the biceps. We passed a stitch through it first so we can later reattach it. I don't think we can even see the edge of it. It kind of retracted a little bit. But yeah, so there's the edge of the biceps is right back there, and when I pull on it, you can see it move. So we're going to go ahead and get to work now on the rotator cuff and the rest of the shoulder stuff that we have to get done for you today. Pause. Okay, so here's the tear. We've already tenodesed the biceps in the front. That's it way up here. Maybe if I rotate the arm, you'll see it. But there's some sutures down right there. That's holding down the biceps. That's actually the biceps right in the middle of the screen. It's in the groove, but it's tied back down. Now, this is the rotator cuff tear, and it's a very large tear, or re-tear, however you'd want to look at it. And this is the front up here. Here's the articular surface. This is all torn tendon all the way to the back here. So we're going to put in at least 2 anchors. Each anchor has 3 sutures. And so we've got our work cut out for us. This is a very large tear like we talked about in the office. So we're going to get to work. We'll give you kind of an interval update in just a little bit. Okay, so there's the first triple loaded anchor. We start way in the back. And then we'll reach in here from the front as soon as I find myself. There I am. And we'll grab these sutures and pass them one at a time from the back to the front. Okay, so we've got the most posterior anchor placed and all 3 sutures tied. You can see it back here to the right. That's way in the back on the infraspinatus side of the rotator cuff. We're now going to place another suture anchor right here. And we'll go off on the video and show you when we're done with that. Okay, hold that for a second. So, okay, so we've passed and tied all the sutures from the second anchor. So there's the first one way back there. There's the second one right here. And now we've still got room to place a third, maybe even a fourth. So we're going to place another anchor down up here to close down this final gap. I actually am going to make another little spinal needle entry point. so I think this is going to be a better angle here. If we get our anchor down right about here, that ought to be pretty good. Pause. 2mm punch. Okay, we're done. We've tied 9 sutures for the cuff and a suture for the biceps. And as you look at your shoulder now, you can see that's all repaired back to the bone. As I rotate, everything's moving together as a unit. We're going to take a punch and make some little holes in the bone here, just so we can open up the marrow space a little bit. Okay, so tap here. Okay, so we'll get this done and then we'll get you back to the recovery room. Keep going. Good luck to you now. Bye-bye. Yeah. Go again. Yeah. That's probably good. That's good.